Hello, good afternoon, good morning, good evening, wherever you're watching me from. I believe you guys are doing well. You're welcome to today's program, Sunday, September the 17th. I hope I'm going to have a chat with you guys today. Let's see how many people that is going to be online today. So I hope you guys are doing well, managing your diabetics, following your doctor's instructions, and then taking care of yourself. Okay. Let's see how many people that are available to join me online. Please, once you come online, indicate where you are watching me from. Kindly indicate where you are watching me from. Once you come online, all right, I'd like to know where you guys are watching me from so that I can give you a shout out. You're welcome to today's program. All right, today I'm going to be discussing type 2 diabetics self care. All right, as a diabetics, you should not spend most of your time in doctor's office. There are certain things that you're supposed to know to take care of yourself at home, at your workplace, anywhere you are. Okay, so that's what we're going to be discussing today. Diabetics, type 2 diabetics, self care. How to take care of yourself, your blood sugar level, your medications, your meals, and exercise. That is what I'm going to be discussing today. All right, so it's going to be an interesting day. And please do not forget to share my page, recommend my page to your friends, and then give me thumbs up if you like what I'm doing here. Once again, you're welcome to today's program, type 2 diabetic self-care, blood sugar, medications, and meals. Not necessarily you're going to spend all your time in doctor's office or any little things you have to rush to your doctor's office. There are certain things you should know by now how to take care of your diabetic situation without going to see your doctor all the time, except in a very dire situation that is above your knowledge that you need doctor's advice. So today we'll be talking about type 2 diabetics self-care. And meanwhile, if you have any question along this program while I'm doing this program, do not forget to send in your questions, ask your questions, and I'll respond adequately. All right. So I'm gonna wait and see how many people join me online. Let's give them 5 to 10 minutes and then we will start the program. All right. So we're going to be discussing about type 2 diabetes, self-care. All right. That's what we'll be discussing today. Type 2 diabetics self-care. All right. So the focus on managing your type 2 diabetes include once everything that has to do with diabetics management includes your blood sugar monitoring. How often do you monitor your blood sugar? Taking your prescribed medications as needed and as directed by your doctor, and working with the healthcare team on your food choices, exercises, planning your exercises, and then you have to be on a good mental health. These are all the components of self-care managing of your diabetics. So everything that has to do about self-care managing your diabetics or at home, at your workplace, or your living town involve blood sugar monitoring. How often do you monitor your blood sugar as required? Taking your prescribed medication as directed by your physician or by your doctor, and working with a healthcare team regarding your diet. And also, in addition to exercise plan. And again, the last one, you have to be in a good mental health. Diabetics drain your mental health. You have to be on a good mental health to take up the challenge in dealing with diabetics. It comes with a lot of stress, it drains your energy, it comes with a lot of confusion and anxiety. All right. It makes you uncomfortable once you're diabetic. So at all times, you have to be in a good mental health to go along with the challenges of diabetics. And then taking care of yourself, it is very, very important. There are certain things that you should know how to do without visiting your doctor all the time. It is not any slighted situation, minor, that you have to rush to see your doctor. As a diabetics, you're supposed to know those self-care help that you're supposed to render to yourself at home. Or if you're a caregiver taking care of someone that is diabetics, there are certain things you should know on how to take care of such person, right? So it is very important. Okay, you focus your management of your diabetics on your blood sugar monitoring, taking your prescribed medication as directed by your physician, working with the healthcare team as regards to your dieting, your exercise planning, and again, you have to be in a good mental health. So these are the things that we have to be going through today. All right. How do I take care of myself? How do I take care of myself while I'm a diabetic, or if you're a caregiver taking care of somebody that is diabetic? Meanwhile, if you have any question during this program, do not forget to ask your questions. Okay? Do not forget to ask your questions. All right. People who need to check their blood sugar more often include. All right. I'm going to be doing this program by asking questions, and I need a response. I'm going to do kind of teasing questions, and I'll ask a question and see if you guys are following the teaching. Okay. If you live with type 2 diabetes, you may spend much of your time on self-care than in doctor's office. Once you're a diabetic, you spend much of your time on self-care than in doctor's office or working with your diabetes care team. All right. Anslan Hanan, you are welcome. How are you? You are welcome, Anslan. Welcome to today's program. Okay, so if you live with type 2 diabetes, or if you're a caregiver taking care of somebody that has type 2 diabetes or type 1 diabetes, you will spend much of your time on self-care than in doctor's office or working with your diabetes care team. All right. Most of your diabetics management is on your own each day. Each day, most of your diabetics management is on your own. That's why learning the best way to take care of yourself is very, very valuable. Once you're a diabetic or you're a caregiver, you must learn how to manage your diabetics, how to render help to somebody that is dealing with diabetic situation. It is very, very important because you spend much of your day, most of your time in self-care than in doctor's office. And if you like the knowledge on treating diabetes or managing diabetics at home within yourself, then you have a problem in dealing with that situation. So that is why it is important to learn how to take care of your diabetic situation by yourself. Only visit your doctor on a rare occasion whereby you need a guidance on certain things that is above your pay grade. Then you have to go and see a doctor. All right. So it is important that you spend most of your time as a caregiver, self-care, managing your diabetes, or rendering help to somebody that is dealing with diabetes than in your doctor's office. Because I know there are areas you're going to have a problem, and that area is on dieting. Dieting is one of the complicated, very complicated aspect of managing diabetics because you are lost. You don't know what to eat, what to avoid, and what to eat at what time and at what portion. So most of the time, you are struggling on what to eat, what quantity to eat, what to avoid. Should I eat this or should I add that? There's a lot of temptations coming along your way. Should I cheat or should I be strictly disciplined in consuming, eating what I'm expected to consume? So these are certain things that you have to struggle each and every day. That is why I said diabetes management is draining. It comes with a lot of confusion, time consuming, a lot of anxiety, frustrations, and then if you're not in a good mental health, it's going to make it to fall more sick easily. All right. So now people who need to check their blood sugar, people who need to check their blood sugar more often include those who, one, get low blood sugar without apparent symptoms. Okay. Now I'm dealing with blood sugar management. Okay. Because I said in self-care management, you're going to deal with blood sugar management. All right. How do you manage your blood sugar? How often do you check your blood sugar? Okay. It includes blood sugar monitoring and then taking your prescribed medications as needed directed by your physician, working with a healthcare team regarding your dieting and exercise planning, and again, a good mental health. Now, let's start with blood sugar management. Which people are needed to check their blood sugar more often? That is what I'm trying to list now. One, if you're diabetic, you get low blood sugar without apparent symptoms. Okay, there are people that have low blood sugar without apparent symptoms. Remember, I've told you guys in the past, you might be diabetic for 6 months up to a year, 2 years without even knowing that you're diabetic because sometimes the symptoms are silent. So sometimes the symptoms are silent. So those who are supposed to be monitoring their blood sugar more often are those who get low blood sugar without apparent symptoms. You might be having a blood sugar without any symptoms. That's number one. Number two are pregnant and have diabetics. I'm not dealing the question of blood sugar monitoring. Okay. So, and the question is people who need to check their blood sugar more often include one, get low blood sugar without apparent symptoms. Two, are pregnant and have diabetes. That is what we call gestational diabetics. Okay. Three, take insulin. Okay. Three, take insulin. Okay. Four, often have a high blood sugar levels. Okay. And then five, test high for ketone levels. These are the people that are supposed to be checking their blood sugar, monitoring their blood sugar more often. Okay. I've listed the five of them. People who are supposed to be checking their blood sugar more often. You have to monitor your blood sugar more often. Let me go back to it once more again. And I say one is those who get blood sugar without apparent symptoms. If you're having a low blood sugar without any apparent symptoms, then you're supposed to be monitoring your blood sugar more often. Two, you are pregnant and have a diabetes, and you're a diabetes. Okay? You're supposed to be monitoring your blood sugar more often. Then three, you are taking insulin. If you are taking insulin, you're supposed to be monitoring your blood sugar more often. And then four, okay, often have high blood sugar levels. Okay? Often have high blood sugar levels. Okay? Then number five, you test high for ketone levels. So these are the set of people that are supposed to be monitoring their blood sugar more often. Okay, so if you fall within this category of people and you're diabetics, okay, then you're supposed to be monitoring your blood sugar more often. Uh, Ansalam said, sometimes when I woke up, my blood sugar makes 10.6. What should I do to make sure my blood sugar well controlled? Is it true that when stress sugar can up? Yes. Anselm, when you are stressed, that is why if you're diabetics, you have to avoid stress. Stress can spike up your blood sugar. That is why you have to be in a good mental health. That is what I'm discussing now. Self-care. If you're a diabetic, you have to avoid stress. Stress can spike up your blood sugar levels. And again, you have to be in a good mental health. Because if you're not in a good mental health, because diabetes comes with a lot of stress, confusion, anxiety, worriness. You are disturbed. Your mind is not at rest. You are confused. You don't know what to eat, what is it to eat, when to eat it, because you cannot even differentiate the portion size control or the amount of carbs you're supposed to consume at each meal. So there are a lot of confusion at a point you get disoriented. So these are all the stresses. The combination of all these can stress you up. That's going to spark up your sugar level. So that is why if you're a diabetic, you have to be on a good mental health. Do not allow your stress to go up, otherwise it's going to spark up your sugar level. Now, the question about your blood sugar 10.6, yes, it's too high. Remember, when your blood sugar will spike up while you are asleep and in the morning. Once you get up in the morning, your blood sugar there's a tendency 8 out of 10 your blood sugar is going to be rising. Okay. Excuse me. Sorry about that. Sorry about that. Anselm, just a minute. I'm going to come back. I'm going to step away from the computer just for a minute. I'm going to come back and then answer your question just for a minute. Sorry, I have to step out to answer your question. What the hell is going on here? I don't like it. Sorry, I have to step out. Get a knock on the door. Okay, now Anselm asked a question that I've answered the question about the stress. Yes, stress can spark up your sugar level. That has been sorted out. Now let's talk about your 10.6 sugar level when you wake up in the morning. Now, if you have, there are several reasons why your sugar level is up in the morning. Let me give you the several reasons why your sugar level might be 10.6 in the morning. Okay, if you have a high glucose level before you go to sleep, okay, there's a tendency that the elevated level can persist till in the morning. Okay, say for instance, um, um, before you, that's why it's advisable to check your blood sugar level before you go to bed, to know your blood sugar levels before you go to bed. You must check your blood sugar before you go to bed to have it recorded down. If you have a high blood sugar before you go to bed, there's a tendency that that could persist till in the morning time. Okay. Now, if you have a large dinner or a snack at bedtime, that can also cause you to have an elevated blood sugar in the morning. That is why it's advisable that you should have your dinner before 7. So by the time you go to bed around 10, 9, 10, 11, your sugar level might have settled down. And then you check your final sugar level before you go to bed. So if you have a high blood sugar before you go to bed, okay, there's a tendency it's going to continue to in the morning. That is one. Secondly, if you have a large dinner before you go to bed, that can also cause you to have a high sugar level in the morning. Okay. And if you have your dinner, say before 7 o'clock, and then you feel that you must, have to eat something before you go to bed. That is why it's advisable to take a small snack, or cut an orange juice or an apple, just a snack or a salad. Do not eat anything heavy before you anything after 7, because that can also add up to spark up your sugar level. Okay. So these are some of the tendency why your sugar levels are up in the morning. I mean, in the morning time. Okay. So avoid large dinner before going to bed, and make sure that you eat your dinner before 7 p.m. And then if your high blood sugar before you go to bed is high, then I don't know, because there are some diabetes medication that you might take twice in a day, one in the morning and one before bedtime. Then once you take your first medication in the morning after breakfast, then your last medication should be taken before you go to bed. So that means after your 7 p.m. before your 7 p.m. Dinner, then between 7 p.m. and 11 p.m., you feel like you want to eat something, look for apple, orange juice, avocado, vegetables, salad. Eat something that is small. Then before you go to bed, take your sugar level readings and then take your final medication, the second medication, before you go to bed. So one medication in the morning, one medication before bedtime. Then once you go in the morning, you see that your blood sugar level is not going to be spiking up. It's going to be level because you've already taken the last medication before you go to bed. So this is how to manage your blood sugar levels. So, okay. So I hope Anselm have answered your question. Anselam, Anselam, Hanan, I think I've answered your question. Okay. Uh, and another reason again, I just remember something now. There's something we call Dan phenomenon. There's something we call Dan phenomenon. Okay, Dan phenomenon is an early morning rise in blood sugar, also called blood glucose in people with diabetes. Okay, the Dan phenomenon leads to spike in blood sugar in the morning. Okay, it's called Down phenomenon. Okay, so that can also lead for you to have a blood sugar in the morning, or any hormonal changes. Maybe you are having some hormonal changes, those can trigger for you to have a blood sugar level rise in the morning. Okay, so Down phenomenon is an early morning rise in the blood sugar levels. Okay, in people with diabetes, the Down phenomenon lead to high rise in the blood sugar, a condition called hypoglycemia. It usually happens between 4 a.m. and 8 a.m. Okay. Uh, So what is Down phenomenon that some people with diabetes experience? Can anything be done about it? Okay. So I'm just trying to explain that, just to give you guys. Okay. So Anselm, I think I've answered your question on that. Um, any more question? Feel free to ask if you guys have any more questions. Okay. Okay. So I've answered that question. So let's go back to what I was discussing before. And once there's any other question, I'll be free to answer it. Now, why is type 2 diabetics management very important? Why is type 2 diabetics very, very important? Now, before I go on to that, let's talk about, before I go on to that, let's talk about, okay, okay, I'll reserve that and I'll come back to it. Why is type 2 diabetics management very important? Managing of your type 2 diabetics is very, very important. Whether it's type 1 diabetics or type 2 diabetics, they are very, very important. Remember yesterday when I was doing a program and I said, do not ignore your diabetics management or care, because ignoring it, not taking care of your diabetic situation can cause you a lot of complications that might even cause you more harm than good. So that is why it's advisable you manage your diabetics very, very well. So managing your type 2 diabetes is very important. Okay? Managing your type 2 diabetes is very, very important. Okay? To avoid the complication of type 2 diabetes, you have to manage it. To avoid losing your eyesight, to avoid any amputation, to avoid any nerve damage, to avoid any kidney damage, to avoid any liver damage, to avoid sexual limitations, okay, erectile dysfunctions or loss of libido in terms of women, you must manage your type 2 diabetes. It is very, very important. So it's all about avoiding the complications. That is why it's very important to manage your type 2 diabetes very, very well. Okay. I'm distracted here. I have a lot of questions coming in here. So I'm reading some comments and then I'm responding. So you're going to manage your type 2 diabetes to avoid those complications. Now, how often should you check your blood sugar levels? Check your blood sugar level as often as you can. So check their blood sugar level there are people that check their blood sugar every 30 minutes. There are people that check their blood sugar every 1 hour, and there are people that check their blood sugar every 2 hours. So you have to devise a plan which is more benefit for you. Every individuals have a different time of checking their blood sugar. There is no stipulated time that says this is when to check your blood sugar. Everything depends on your accuracy, your discipline, the seriousness of you taking and managing your diabetes. So observing your symptoms, know when symptoms occur within yourself and interpret it. So there are people, it can be every 30 minutes to check your blood sugar level. It could be every 1 hour, it could be every 2 hours. But the most important thing is that you are keeping record of your blood sugar readings. You monitor your blood sugar at all times, keep the records, and then interpret any number that come across your blood sugar monitoring. Okay, you have to understand the number. Once any number comes up when you monitor your blood sugar, you should be able to interpret it to know what it means. You have to be able to know, oh, you know what, my blood sugar is elevated, I need to come down, or my blood sugar is below the line, I need to come up. So also you have to also know how to interpret the symptoms that comes along with it. Okay, if you don't know how to interpret the symptoms or study yourself, your body, and know when the symptoms occur, to say, you know what, I'm feeling some shiveriness, or I'm feeling some cold, or some nerve pains, or some tingling or numbness on my feet, or I'm feeling weak, or I'm feeling dizzy. These are some of the symptoms you should be able to interpret to say, you know what, let me check my blood sugar to know why am I feeling these symptoms. And when you look at the number, you say, okay, now I know why these symptoms are occurring and know how to handle it. So checking your blood sugar differs by individual to individual. The most important thing is that, are you checking your blood sugar? Are you keeping the record? Okay, it is very important. You check the records and then keep them. Inam, you are welcome. You are welcome. You are welcome. So it is very important you check your blood sugar levels at all times. Very, very important. Okay. Now, let's talk about the meals. I'm going to talk about the meals. Okay. What to avoid and what to eat in managing your diabetes, because meals are also a very important part of managing your diabetes. So let's talk about the meals now. Ruth, you are welcome. Ruth, you are welcome. So let's talk about the meals, okay? Because they are part of managing your diabetes. Now, I'm going to post something here. For healthy eating with diabetes include, okay? That is, these are certain things. If you're managing your diabetes, there are certain things you have to avoid, because, as I said, it comes with a lot of confusion. Dieting is the most hardest part of managing diabetes, because you sometimes, if you're newly diabetic, you don't know what to eat, what to avoid, what portion to eat, at what time. My carbs, how do I count the carbs? It is the most difficult part among managing diabetics. So for healthy eating with people with diabetes include learning what serving and portion size look like. So if in managing your diabetes, okay, self-care diabetes, you have to learn what serving and portion size look like. Remember, I said in my numerous video before, you can eat as much as you want, large quantity in one time. But once you're a diabetic now, you cannot eat those large food anymore. It has to be in a smaller portion. But the question now is that, if you are newly diabetic, most people are confused. How do I know what portion size look like? What is the portion size should I consume? What is the number of carbs in those portion sizes? Okay. So it is part and parcel of your self-care help in learning what serving and portion size look like. That is number one. Number two, monitoring sugar and learning what item contain added sugar. Remember, I've told you guys in terms of nutrition, there's something they call added sugar, okay, and the natural sugar. Sometimes you see some labeling says there are some added sugar on it, and so will tell you there's no added sugar. It comes natural, dietary sugar. So you have to, after you have to learn what size, serving, and portion size look like in managing your type 2 diabetes self-care, monitoring sugar, and learning what item contains added sugar. When you go to a shop to buy food, or you go to the shop, a big supermarket, you are looking at the content. Should I buy this? Is this fit for me? I'm a diabetes. Does it contain added sugar or doesn't contain added? If it contains added sugar, what is the quantity per serving? So these are the certain things you're supposed to be learning. Okay. Number three, drinking water and limiting sugary beverages. So once you're a diabetic, you got to limit sugar beverages and replace them with drinking a lot of water. Okay, you got to replace beverages, all those sugary beverages, throw them away, and then replace with a lot of water. Okay. Number four is avoiding fried foods. So if you're used to patronizing fast food joints, okay, now once you're diabetic, you have to avoid fried foods because of the saturated fat. You don't know what kind of saturated fat they use in it. So once you're diabetic, you have to avoid fried foods. And number five, avoiding saturated fat. That is why you also have to avoid fast food joints. Remember, I said fast food joints, they don't care about your head. They are there to make profit. So they are there to make, they don't care about your head. So what they are doing is they are producing quantity, not quality. If you want quality from them, then they're going to charge you extra to prepare your own food customized the way you want it. So that is why if you're diabetic, you have to avoid saturated fat and limiting patronizing fast food joints. And number six is choosing lower or low fat dairy and cut off meat. I've told you guys about red meat. Instead of red meat, you have to go for lean meat. There are difference between the lean meat and red meat. So these are certain some of the things you have to learn. And that is why I said among all the components of managing diabetes, dieting is the hardest part of it, because that is where you have to learn a lot of things. And if you cannot capture those areas, then you find it very difficult. Even if you're taking your medications, you see that you're taking your medication, but your blood sugar is always constantly high, because what that aspect of dieting has not been dealt with. So for you to manage your diabetes very well, you have to look into your dieting, have knowledge of your dieting. That is when your medication is going to work. Okay, that is when your medication is going to work. All right, and then number seven, let's go to the last one. Seven, eating the correct amount at ideal time. Eating the correct amount at ideal time. And then eight, focusing on whole foods. I've told you guys about whole food instead of all this regular white bread, white rice. Now you have to change from white rice, white bread to brown bread, from starchy food, carbohydrate food to whole grain foods. Okay, you have to go into oatmeals, grain foods. These are where you're going to concentrate your energy, because those contains a lot of fiber and carbohydrate. And number nine, eating more non-starchy and green vegetables. So you have to avoid starchy food and go for green vegetables. Those are certain things you have to learn in self-care. Okay, in managing your diabetes. All right, I think I'm coming to an end. Do I have any question? Because I'm almost today. I want to do. I'm not going to spend an hour here. I just want to do a quick one, and then and then So, do I need a diabetes education? Okay. Do you need a diabetes education? That is the question. Okay. If you're a newly diabetic patient, yes, I would recommend. But with time, you're going to be an expert in that area. Okay. With time, you are going to be expert in that area. But because you're going to spend a lot of time with your doctor or with a specialist in discussing issue related to diabetes. Okay. So managing diabetes and making lifestyle changes can come with a learning curve. Working with diabetes educator can help you make better choices that may help you better manage type 2 diabetes. Okay. So I would recommend uh, I recommend if you are newly diabetic, if you are confused, to seek help. Okay, to seek help in learning the tips about diabetes. It's very important. Okay, some of the skills diabetes educator can help you learn uh, may in a so let me come. Okay, may include all right. One, managing your blood sugar. Two, eating well. Three, exercising enough. Four, diabetes related problem solving. Five, fitting self care into your lifestyles. So that is why if you are confused in managing your diabetes, it is advisable that you seek a help from a team specialist in diabetes and learn managing your blood sugar, eating well, exercising enough, diabetes related problem solving, and then fitting self care into your lifestyle if you are confused. But I know it's going to, once you are enrolled into those programs or you belong to a community programs, there are some community that have some diabetics community program that you can join to learn. It's not going to take you about up to 3 months for you to, get used to uh, the ins and out of diabetics. All right. So please do not forget to like, comment, and share, and subscribe to my channel if this is your first time. All right. If this is your first time, do not forget to subscribe to my channel, all right, and give me a thumbs up if you like what I'm doing. If you like what I'm doing, do not forget to give me a thumbs up, all right, and subscribe to my channel. All right, thank you guys very much. So these are some of the things joining a community program that are teaching about diabetes. You're going to learn some few things about diabetics in it. All right. So as I said in my beginning of my program, I'm not going to spend much time today. I'm going to be calling it a day for now. And then if you have any further questions, do not forget to send me a comment or send me an inbox message, and I'm going to respond if you have any question regarding diabetics. high blood pressure, cholesterol. Okay, I'm here to give my own, give precise advice and guidance in managing your diabetes. At the same time, I respect your doctor's decision in treating your diabetes. Okay, if you are confused about managing your diabetes, please do not forget to revert back to your doctor, family doctor, and seek further clearance. It is important you listen to your family doctor. All right, they are the best professionals that will be able to give you guidance in managing your diabetes because they have your clear record with them, so they'll be able to guide you in managing your diabetes. I don't have your record within me. You are not my patients. I'm only here to give you guidance and encourage you in managing your diabetes. Okay. So my opinion may not override your doctor's opinion. My opinion may be in addition to your doctor's opinion, directions, but in every situation, uh, once you have any problem, I normally advise my fans to go back to their doctor to get any clarification regarding their treatment of diabetes. Before you take any drug, in addition to what your doctor is giving you, please always ask your doctor if you have any new drug you are taking that he or she is not aware of. So your doctor will be able to tell you either to discontinue those such drugs or to go ahead and then take that drugs. Even if it is a supplement or any herbs, make sure your doctor know that you have other medications you are taking. All right. So we are here to give guidance regarding diabetes management on how to live and manage with diabetes. So if you like what I'm doing, do not forget to give me thumbs up and then do not forget to subscribe to my page. All right. And once again, do not forget to send me star if you guys appreciate what I'm doing. So once again, I'm going to thank you for today's program, September the 17th. And I'm going to see you guys some other time. Enjoy your weekend and then stay blessed. Goodbye.